Hi, I'm Arpan Patel. I'm one of the interventional pain doctors here at the Iowa Clinic. Sciatica is a very generic term which describes pain which goes from the low back into the leg. The reality about sciatica is that it can happen for a variety of different etiologies, including vascular issues related to diminished blood flow into the leg, muscular nerve compression. It can happen from disc herniations and arthritis in the back, which can cause nerve compression. And it can also happen from any kind of peripheral nerve entrapment in the leg itself. In terms of treating sciatica, the preliminary things that we can do at home at least is take non-steroidal anti-inflammatories, things like ibuprofen and Aleve. And you can also do lumbar flexion and extension exercises to strengthen your back. If those don't help, then you probably would want to do regimented physical therapy and do those flexion and extension exercises with a therapist who's specialized in mastering those ranges of motion. Further along the treatment pathway, we can do an epidural steroid injection, which is a targeted delivery of local anesthetic and steroid to the area where the nerve is being pinched, usually in the low back, if that is the cause of the sciatica. And then eventually, if you're getting to a point where the conservative management is not really working, then we start talking about surgical options in the form of either a laminectomy or a fusion, and that's when the referral to our surgical colleagues comes into play. Many times, patients have already had surgery, could be within the last couple of years or many years prior, and if there's persistent sciatica-like pain after surgery or even with hardware in the back, then we start talking about more advanced treatments like spinal cord stimulation to work around the scar tissue and the nerve compression that is already there that may no longer be operable. So typically when we're doing physical therapy, that's about the time where we introduce neuropathic pain medication, and typically those medications are things like gabapentin and Lyrica, and what they really do is they provide some degree of anti-inflammatory benefit to the area where the nerve compression is happening, but they're in a family of medications called calcium channel blockers, which ultimately prevent these painful nerve impulses from going from the area of the nerve compression to the brain. And that ultimately helps you with pain control, and then it helps you do your physical therapy activities better so your body can heal. Most people who take neuropathic medication in the context of a lumbar radiculitis or nerve compression in the back typically are on the medication for approximately 3 to 6 months. The amount of time that you're on the medication is largely dependent on how you're progressing with conservative management, how bad your initial disc herniation is, how functional you are, your body habitus, whether or not you're obese or not. All these things really play a role as to how long you'll be on the medication. And the thing we have to really realize is that everybody heals at a different pace, but typically it's 3 to 6 months. So typically if you have sciatica pain and you've tried some home exercises and you tried over-the-counter medications and they're not working, the best thing to do would be to obtain a referral from your primary care doctor to see a pain management specialist, or contact the Iowa Clinic Pain Management Department to schedule an appointment with one of our providers.